If your child will not look like you, you can sue me. And I prefer to work and enjoy my medical life rather than have regular meetings with lawyers in a court. According to the Spanish law, we have to generate a child that will fit in to your family. I always say to patients that we have to find you a twin sister, somebody who looks like you, has the same color of hair, the same color of skin. So when the child will be born, everybody has to think that you are a genetical mom. And then, when you carry the pregnancy, you are going to the gynecologist for the follow-up once a month. They have to scan you, they have to see the heartbeat. They have to do the genetical testing of the screening test of yours at the week 10, 12. Then you deliver the child. So trust me, psychologically, after this journey of, growing the baby in you for 9 months, you feel like a mom. We have here in Alicante more than 1,000 donors in the database available for you. Before the war with Ukraine and Russia, we had an issue with donors with blonde hair and blue eyes. I think that, out of this mess that has been generated in Europe through this conflict, we have a huge immigration of Ukrainian young, beautiful girls who have to learn the language. They start, their careers here. They go to universities here. A lot of them are freezing their eggs for themselves. And if we see the quality of eggs and the number of eggs and the phenotypes, we want to support them, and we ask them if they would like to be our donors. So we do have a lot of donors now from Eastern Europe who fit patients with blonde hair, blue eyes. On the other hand, here in Alicante, we had an Arabic influence for more than 400 years. So these beautiful, Spanish girls who I always envy the suntan, we have available for patients with darker hair and brown eyes. Yesterday we had a beautiful lady from UK with mixed ethnicity with an African background. And in this kind of cases, we also have mixed ethnicity donors from South America. And in this kind of cases, we say to patients that we do not have like pure African or Chinese donor, or we ask if they will accept mixed ethnicity donors, but look like them. Of course, the donors are matched to you with artificial intelligence, where, AI shows me the shape of your face, I know mouth, and then I know scientifically which donor is the most suitable for you. Of course, I trust the AI, but as always, I control them. So once a week we have a meeting where eventually me, your PA, and the lab director, coordinator of egg donation is present, and we choose the best donor for you. So, before we choose the right donor for you, there are certain steps that need to happen to make sure that when the child is born, it fits to your family without any questions and doubts. Spanish legislation in the 80s allowed for an anonymous egg donation until 52. And if the embryos are generated at the age of 52, we can basically use them until 52 and 11 months. So basically until probably 53. You don't wait that long for an egg donation. When you are 42, 43 years old, you tried everything what's available in your country and you are not getting pregnant, and we have an answer that probably your eggs are genetically abnormal, we check them through PGDA, or you have a low ovarian reserve, there's no eggs, or no fertilization of your eggs. This is the moment where we recommend you to go for an egg donation. I know that in European countries, when you are over 40, you are old. I don't agree, because these countries discriminate you because of your age. Spain allows for a treatment with donor eggs until 52, and we'll be more than happy to support you in this journey. Egg freezing, the social freezing, was performed a couple of years ago on patients with oncological issues. Me, myself, I had eggs frozen before the chemotherapy in the US. And then the story of freezing an oncological patient caused a lot of different opinions. And then eventually we understood that, you know, when we women, when we are born, we have this certain amount of eggs and certain quality of eggs in our ovaries. The best eggs we have until we are 35 years old. The number of genetically normal embryos that we generate at the age of 35 is 50-60%, and then the quality of them drops down dramatically. So the problem is that, you know, when you go to the university and then when you have your first job and your first stable income, you are 35, 38 years old. So the best fertile age modern European women spend at school. So I always say that I am third generation gynecologist, and I saw how the generation of my grandmother after Second World War in Berlin was fighting for the smear test that are done now routinely once a year, or if we combine them with HPV every 3 years. It wasn't that obvious in the European Union of the 40s. I saw generation of my mom fighting for mammography screening regular. It wasn't so obvious. My generation is responsible for testing all pregnant women for HIV and deliveries of HIV negative children to 98% of HIV positive mothers. And I hope that my generation will be responsible for egg freezing program of young women younger than 35, 36 years old, and for not doing an egg donation in 10, 15 years with donor eggs, but using own eggs, own frozen eggs at the age of 35 by women who then economically and professionally establish themselves until the age of 52. Don't close yourself, as European Union is trying to lock some doors behind us. I hope UK will change it in the future. And, it doesn't cost anything to have an online consultation for the second opinion. It doesn't cost anything to see in social media the successful stories of patients from your home country who made it in Spain, who made their dream come true of having a healthy baby and a happy family. When you allow yourself for the first appointment with us, we will organize your flight, transportation, your accommodation, your plan. So you'll be flying to Alicante for a week for vacation. But during this time, your body will be prepared either for an egg retrieval or for a transfer of your donor embryos.